Okay, so right now it is going live. So what I'm sending out is going live to um, Facebook. It is going out to YouTube. Um, and so then this will be our test. So in our normal test, Diana would be on stop video. So it's full screen. Um, and then Brian, I'm going to start the video here in a second. I need you to tell me, you can just yell at me that you can make sure that you can hear that you can hear everything from program.
Okay.
Okay, do you have sound, Brian?
No. I see video, but no sound.
Okay, then I know there's a audio thing I have to switch here real quick. Okay.
No. No.
Third Wednesday of
There it
every
is.
month through April 2021. Each town hall will include Orange County Healthcare Agency public
What's
health
that?
expert and frontline staff who are
Everything's in
working
English.
around the
I
clock
see it here in
to
English.
help end this pandemic and save lives. Their goal is to be transparent at all times so you can make informed decisions. Tonight, we're sharing facts about the Moderna and Pfizer vaccines and learning about the county's vaccine rollout efforts.
I
So
switched
you
to Spanish. I
can share
didn't
that
hear Diana, though.
with your loved ones. I know a lot of eligible seniors are looking to their children to help them secure an appointment online, and this town hall will provide some guidance. If you have questions during the town hall, please enter them in the comment boxes and we will answer them towards the end of the evening. With us right now are our two esteemed panelists, Dr. Clayton Chow and Helen McPhee, and I couldn't be more grateful for them for joining us this evening. Helen McPhee is Chief Transformation Officer for Memorial Care, a nonprofit healthcare system with 4 hospitals, 1,350 beds, a medical foundation, and over 2,600 affiliated physicians in Southern California. She also serves as executive administrator for Memorial Care's clinically integrated network and has been leading the COVID-19 Command Center team. Helen's passion is to attain the safest and highest quality care for every patient and family. And Memorial Care has been partnering closely with the county to deliver vaccines to high-risk communities, which Helen will delve into a little bit later this evening. Also with us is Dr. Clayton Chow, Director and County Health Officer for Orange County Healthcare Agency, who joined this agency last April. He brings a wealth of knowledge and guidance, and his staff manages one of the biggest healthcare crises of their careers. Dr. Chow previously worked as Chief Clinical and Strategy Officer for Mind OC, a not-for-profit created to support the Be Well OC program. He has also worked in major hospitals, including Providence Health System as the Regional Executive Medical Director of the Institute of Mental Health and Wellness. Dr. Chow has been at the forefront of the pandemic in Orange County, guiding many of the public health measures that we are all practicing today. We're excited to have him share his perspective and knowledge with us tonight. So again, thank you so much to Helen McPhee and Dr. Clayton Chow. At this time, I'm going to invite Dr. Chow to take it away and provide us with some key updates about COVID-19 and the vaccines.
Thank you so much, Mayor Kim Park. Good evening, everybody. It's a privilege to join you tonight, just to have a conversation. And my intention is to have this as a conversation to discuss the vaccine, COVID-19, and it's a privilege to join Dr. McPhee, whom we've been working very closely in carrying out this important task. I know many of you have had some frustration with the rollout of the vaccine. And I want to share with you that it's not only Orange County, but the entire state as well as the entire country have been quite frustrated with the vaccine process. And mainly, I want to tell you, is because of the limited number of vaccines available currently.
Uh-huh.
With that said, I want to remind us that the vaccine only came into our county
English.
6 weeks ago. 6 weeks ago. The very first day, the first Orange County resident who got the vaccine was on December 16th. It sounds like a long time ago, but it was not. And that day has always been in my mind because that is the beginning of the end of COVID-19. That is the hope that I want us to all carry with us, right? So we'll talk more about what we need to do, but let's plunge right into it. Next slide, please. So currently there are 2 vaccines that has been authorized, not approved, authorized for emergency
No audio.
of the country in the
Oh, now it's back.
Europe unions as well as South America and what have you. Those are Pfizer and Moderna. Want to make sure that we understand that in the process of evaluation to authorize a vaccine, the FDA, which is the strictest entity in the world in reviewing and allowing or approving any medical product to be used by the US, have gone through, thoroughly investigate and review all of the outcome of the clinical trial of over 73,000 participants worldwide to make sure that the drug company, the manufacturer, did not skip a step. I want to make sure you understand that. Because of this is a global pandemic,
What's that?
there's this effort globally involving many governments and many philanthropists. There were preparation
It works.
procedure and resources have been poured into
But you can get it in
developing
English.
vaccine that it afford us to really have
I can hear Diana in Spanish.
for usage in a
Oh, good. No, it sounds good.
a general approval for any medical product. So for those of you who are interested in that, you can
Keep
follow
going, Diana.
on the CDC website and the FDA website, and both websites have discussed thoroughly on how these 2 vaccines get to where
Diana,
they are.
we may have to have you come in to do this because
Exciting thing
you're
about
breaking up a little bit here and there.
more than any
So
of the
I don't know if
vaccines,
you're hardwired or you're doing this
the
wireless,
effectiveness
but
of these 2 vaccines
it's
is over 94% after
okay.
a week of your second dose.
Yeah,
And remember,
perfect.
it is not a very
And Brian, if it's pretty intense as far as going fast or something, we can sort of tag team.
used to.
So we can take paragraphs or
I remember
we
when
can go
Sure.
doing this,
minute by minute or something like that.
Yeah, if you want to be here also. So this is
they
this
wrote
upcoming Wednesday
their
at
seasonal
7 p.m. and we're going to be here at 6
go.
to start the prep
This
work
is
on it.
a very carefully thought out process with lots of requirements for the vaccinator. And I hope Dr. McPhee will describe some of that when she does her presentation. So you have to report it. You have to
I
make
missed it. Say it again.
information are reported up to the state, and then the state in turn reported up to the federal government. There are
No, and that's intense. I've seen the interpreters at the city, they usually have a team, because it can get so fast,
critical timeline.
and that'll give you a chance to rest too, in between.
Are 21 days apart, and for Moderna is 28 days apart. And then because of the
Mhm.
vaccine, this is an mRNA vaccine, It is safe. It doesn't change your DNA, and it lives very shortly.
Yeah, and that way we can prepare. We can have it in Spanish already and
Vaccine are considered
be
quite
ready with the vocabulary in case they
storage. One of them
we have questions related and all that.
90 degrees below zero, and then for Moderna, it's minus 25 degrees at least. And then when you pull it up to the refrigerator to the room temperature, you have a very short window to use it. Otherwise, you have to discard them. So they are very, very delicate, I would use the term. But the mRNA vaccine technology has been around for more than 2 decades. So this is not new technology. This is old technology that has been perfected.
Diana, are you there?
Combat.
Oh, okay. Oh, good. Okay, because I was hearing
Questions on
English
whether or not
from
the government can
Dr.
mandate
Chow,
the
and I wasn't sure.
vaccine, because these two vaccines.
Oh, okay, good. Okay, we're trying to figure out, Martin's working right now to try and figure out how we can get, we've got, now it's working on the Zoom platform,
required,
but we're trying to figure out, if you call in, because right now if you call in, you hear only the English version.
Now there has
We're
been
trying to find out if there's some kind of a toggle
in the
switch
labor
that
law
will allow people to hear it in Spanish.
discussing whether or not an
And Brian, on Zoom,
Yeah.
employee
there's an option that I clicked. It says language interpretation.
Correct. And that's on your
Medical-
computer. But what about for your phone?
one of them
Oh, gotcha.
That's what we're trying to figure out. So we're trying to figure out if somebody calls in with a phone, with their phone,
Oh,
can they hit like, one for English, two for Spanish,
mandate
toggle back and forth.
their employees.
So we're trying to figure that out now.
Others have done so across the United States. So we still have to wait and see whether or not that would mean.
So just hang out, guys, for a little bit longer. Sorry.
Can't mandate the vaccine. So more to come. Next slide, please.
If you want to, you don't have to. No, you just hang out for a second, and we'll jump back on as soon as we as soon as Martin's looking into it, as soon as we figure something out. Give us a couple minutes.
Antigen or the virus itself, and then you will not be test positive for COVID-19. That also said, well, if I have the vaccine and I finish the cycle, can I still get infected? Evidence is iffy. We believe that perhaps yes.
Pardon?
You can. Just like if you get the flu vaccine, the seasonal flu vaccine.
Oh, good. Thanks for your additions to that spreadsheet.
You are
Those
reactive
are pretty
to
good.
it, or you're not reactive to the vaccine. And scientists are still learning more about it. And that's the reason why.
That's what I thought. I drive by a lot in that area, but if you live there, and I remember you went to Foothills, so you really know the area well.
70% or more of the community have gotten the vaccine. People who have the vaccine still need.
Yeah.
All right. Sorry about that, guys.
And how are you? How's the Jean Hernandez thing going? Mm-hmm. Wow. That's good.
All right. Hey, guys.
Hey.
Yeah, okay. So, yeah, they just kept throwing things at us, and I found a way to do most of it. Yeah, the one thing I can't figure out is how to do a Spanish call-in line, and it might not even be possible, but this, at least we've proved that I can send our our Zoom to so I can send our Zoom to YouTube. I can send it to Facebook at the same time. If people need Spanish, they can join the Zoom and use the Spanish feature. And then
you can always offer to, for people who join, they can type in Spanish. We can translate the question to English.
Yeah, I don't know. So that'll probably be part of that. If you have questions, and we'll have to script that. So, okay. I know, Brian, do you have any other thoughts at the time?
No, I don't think so. Other than to say, I think Diego and Diana, it'd be best if you were both in the office on Wednesday, if you could, and just plan to be here maybe 6 o'clock or a few minutes before. And we'll practice maybe a dry run before people start logging on at 6:30.
Sounds good.
Yep.
All right.
All right, guys.
Thank you so much. Thanks for your time this afternoon.
Yeah, you're welcome. I had a question for Martin, and maybe you, Brian, have gone through this. We're almost done with that survey for Huntington Beach. There's a question about my phone, having my cell phone on the survey. What's your thoughts? Should we have my phone, or should we have some generic Google Voice or something like that? And again, this is related to some sensitivity in the Oakview area toward communications lab or barrios and asociados or something like that.
I mean, really, it's up to you at your comfort level. But if you, what do you think, Martin? Is a Google Voice
get a Google
number
Voice number, Diego? I mean, and just have anything.
I think it's safer, it's easier, and that way you don't have to worry about it.
Yeah, it just puts a little fence up around your personal information.
Gotcha. I've never done it before. I know you've used it before. What's the easiest way to go? Just go to Google and write Google Voice?
Yeah, I think it's like voice.google.com.
Mm-hmm.
And then you'll create a phone number. And then...
Oh, cool.
Yeah. Mm-hmm. Yeah, and
awesome.
Then all you'll do is then you'll say, how do you want it to happen? What do you want to happen when it calls? And you just say forward to a number. You'll put in your cell phone number, and then they'll text you a code just to verify that you have access to that. And then it'll ask you how you want that number to appear when it calls. So let's say, I don't know, Juan from Oakview calls the number.
Mm-hmm.
So he calls the Google Voice number. Google Voice forwards it to you. Do you want Juan's number to come through, or do you want the Google Voice number to come through? And the way I've done it in the past is I'll have that Google Voice number saved in my contacts. So that way it'll say like survey participant or something like that.
Oh,
so
good
that way
idea.
you know how to answer the call, because otherwise you're being just answering, hey, it's Diego, and they're like, yeah, I'm calling about the survey. So it just kind of helps you out a little bit.
Gotcha. Great idea. Well, thank you.
All right. Well, thank you guys. Appreciate it much.
Thanks.
Our pleasure. Have a good weekend, everyone.
Thanks.
You too.
Okay. See ya.
Take care.